Well, hundreds of new laws go into effect in Texas on Sunday, and one of those raises the legal age to buy tobacco products to 21, with an exception for military members. This morning, we are joined by Houston's local health authority and EMS medical director, Dr. David Persse. Good morning, and thanks for being here.
Well, thank you for having me.
Okay, with this change, why is it so important that we have something to deter people from smoking?
Well, there's a number of things. First of all, I think it's pretty well recognized that smoking can have devastating health effects on people over the years. The other thing we know is that young people, especially those who are just turning 18, they're getting a lot of freedoms as young adults. They start trying a whole bunch of things. And we know that 9 out of 10 lifelong smokers actually had their first cigarette before they were 18. So anything that we can do to push that off until maybe they're a little bit more mature to make that choice is probably going to reduce the chances they become lifelong smokers and then suffer all those negative consequences.
Okay, but it's not just cigarette smoking, it's not just, pipe smoking or other types of smoking, but there's this new electronic thing called vaping.
Right.
And that's causing a few other problems because recently we've heard about some lung illnesses within the state of Texas with some young folks who are having problems.
That's right. This is a new phenomenon. So vaping has been around for a couple of years now, but really within just the last several weeks, we've noticed a phenomenon across the country. There's been about 200 cases across the United States of people suffering very severe lung injury. Now, this is not an infection. It's an actual injury to the lung. And here in Houston, just in the last couple of weeks, we've had our first cases, and we've had 6 in about 2 weeks or more. So this has popped up very quickly across the country, and we're seeing our first cases here in Houston. Completely a lot of mystery about what's causing it, and the investigations are ongoing to try and figure it out.
So the age now from 21 lowered to 18 affects not just real tobacco products, but also these e-vaping devices?
So actually it's going from 18 to 21.
Oh, I had it in reverse.
That's okay, but it's going to 18 to 21. And it's for the tobacco products. And so, part of the problem like with vaping is that you can get it over the, you can get it online. Yeah. Well, you can get it over, but you can also get it online. And so it's going to be a little bit more difficult to enforce that law.
But those e-vapes also have tobacco in them.
Right. In fact, most of them, that's the whole thing, is that they're sort of being portrayed as a safer cigarette. Well, the reality is it's what you inhale is the problem, and many of those, the smoke that you inhale has many of the exact same contaminants in regular cigarette smoke. So there's a lot of debate as whether or not they're safe or not, or safer. They're not safe. Let's get that clear. Mm-hmm. They're not safe. But the argument is that they may be safer, but they're definitely not safe in that there's no risk. And with this new phenomenon we're seeing, there absolutely is increased concern.
I'm going to ask you to project, let's say, the next 5 years. What do you foresee now that the age has changed?
I think that we're going to see is in other states, the numbers have changed, the age requirements have changed. And I'm hoping that we're going to see some reduction, but it's not going to be enough. We as a community need to do more to educate young people of the dangers of smoking if we really want to get ahead of it. And so I come from a family where everyone in my family, both my parents and my brother, all died as a result of cigarette smoking. And so as a young person who's, made of steel and invincible, they figure it'll never get to them. But eventually it will. And these consequences are real.
Well, let's hope that the new law does save a lot of lives. Dr. David Persse, thank you for joining us here.
Thank you.